We want to make sure that we talk to Kajiado Governor, Joseph Ole Lenku. Kajiado has now confirmed 2 new cases, and right now he's joining us by way of Skype. Governor, thank you so much for your time this morning. Allow me to perhaps begin by requesting to know how prepared is Kajiado County in terms of during this war of the pandemic, during this war of COVID-19. How prepared is Kajiado?
Thank you. Yes, Kajiado, like the rest of the country, are going out of their way to contain the pandemic and also to make sure that the community is sensitized. And so, yes, as Kajiado, remember we had the first index case. And as a result, we had to create an intergovernmental agency that brings together the county government, the national government agencies to monitor, to control, and to prevent the spread of this COVID-19.
So, Governor, on a scale of 1 to 10, 10 being the highest, how confident are you that your county is ready to handle COVID-19?
For all that the county is supposed to do, like the setting up the isolation center, the quarantine centers, and contact tracing, I will say that we are at very high level.
How many isolation centers do you have, Governor?
Of course, the treatment and testing. Sorry?
How many isolation centers do you have?
We have 5 isolation centers in all our key centers or our key towns. In each sub-county.
And the capacity, how many can it hold? How many can each isolation?
The isolation centers have, each isolation center has an average of 10 beds, meaning we have a total capacity of 60 beds in the county.
All right. All right. Thank you, Governor. Governor, what about, do you have enough PPEs?
Yes, we have provided all our health staff, those who are in contact or supposed to be in contact with those who are in isolation centers, and in all our hospitals, we have provided sufficient PPEs. Yes.
All right. And Governor, you were telling me that you have 5 isolation units, and each isolation unit can hold how many in terms of capacity? What's the maximum that one isolation unit can hold?
12.
12. And do you have any ICU capacity as
well? We have ICUs, 10-bed capacity ICUs in the 5 key hospitals, each equipped with ventilators. And so the ICUs that are equipped with ventilators, ICU beds, are now in place in Kajiado. And of course, the sensitization of hand washing, keeping social distance are all in place in our marketplaces, and our communities are fully sensitized. Yes.
Governor, how many medics do you have, and will your medics be getting special allowance during this time?
Already 542 of our frontline staff have been trained on this COVID-19. And yes, about better remuneration for our health staff. This is a conversation that had taken place much earlier, but we were unable to implement because of the directive from the president. But now with the leeway, that conversation has begun again, so that we see how we can really support our health staff. Definitely, we are very, very grateful of the various health teams working in all our hospitals. We know the sacrifice they are making to attend to the people. And so they really deserved better remuneration, better compensation. And it goes without saying that their safety also comes first.
Governor, have you mapped out how many vulnerable people are in Kajiado?
Kajiado, by virtue of their contact, our proximity to Nairobi, we time and again from the Ministry of Health get instructions on contact tracing. So far, we are following 63 people who were supposed to have come with contact. But fortunately for those whom they came into contact with were tested and were found negative.
Right. Governor, that's
Remember
in terms
also that the recent developments or directives from Nairobi or people who came from Namanga or into the country, some were saying they have had contacts with the Kajiado. However, a number of those who are taken for testing have actually come out negative. That automatically means that their contact tracing also does not now pose any threat.
Right. But Governor, that's in terms of contact tracing. Vulnerable people, I'm talking about perhaps the street families. We're also taking a look at people who are in the older age bracket, the vulnerable people, people who need food as well. How many people in your county need food as we speak now?
Oh, it's a very big problem in Kajiado, because remember in Kajiado, again, as I said earlier, by virtue of our closeness to Nairobi, we have actually 3 slums. One slum in Ngong, actually 2 in Ngong, one called Gishagi, another one Madare, and we have also a slum community in Kware, Ongata Rongai. And the numbers have already been taken in. Of course, the larger rural Kajiado also have a very, very poor and old and vulnerable community. That list have already been compiled and submitted to the Council of Governors, which was the contact point with Department of Special Programs in the Ministry of Interior to provide relief food. So the list have already been submitted.
All right. Thank you so much, Governor, for that. Governor, how much funding do you have as Kajiado County government? How much funding do you have?
Recently, through our county assembly, we managed to allocate 135 million into this emergency. And so as a county government, we have, through our supplementary budget, allocated 135 million towards this pandemic.
And Governor, you deal with a very unique group of people. Maasai people by nature, by their culture, they're pastoralists. They move up and down. During a pandemic such as COVID-19, for the pastoral community, what is your government doing? What unique ideas, what unique strategies do you have to maintain COVID-19? Because you already have 2 cases, but what strategy do you have to combat that, the issue of culture for the Maasai people who are pastoralists moving up and down?
I think this COVID-19 will not only be about the Maasai people, it is really about the people of Kenya, in this particular case, the people of Kajiado, where everybody is supposed to keep a social distance. Everybody is supposed to wash hands as directed by government, because this is a scientific problem that have scientific guidelines that needs to be followed.
That's true, Governor, but Maasai are pastoralists. That's true, Governor, but Maasai are pastoralists, and at the end of the day, because of the moving that they have to do, what unique ways as Kajiado County government will you deal with this unique situation, this culture unique situation?
I think I think the cultural aspect that really we are concerned here is even more the way of greeting rather than pastoralism, because fortunately now it is actually a rainy season. Normally pastoralism is rampant during dry spells where people move in place in search of pasture, which is actually not the case now. And so I don't think the pastoralism element is the problem. It is the culture that may be the challenge, because people are used to greeting through touching heads or shaking hands, but that has already been fully sensitized and people are following the directives. It is actually out of that compliance that we recently opened our markets, our cattle markets, because we found out that all the requirements to contain this COVID-19 or providing hand washing points, people keeping a safe social distance is fully complied with. On the cultural front, where we are asking people, you don't have to tie the children's heads when greetings, or you don't have to hug for women, we are certified that people have fully understood and they have complied. I must say that Kenya as a country has done very well to sensitize its communities and its population about this. The level of awareness are very impressive because in every area, people now know there is a problem called COVID-19 or corona. And so they know what is supposed to be done to stay safe or to contain it, and they are complying. I only want to encourage that we keep the sensitization going forward. The local FM radios are doing an excellent job. The administration, both the national administration and county administration, our chiefs, our administrators have done a wonderful job. And of course, the curfew has heightened the awareness that really there is something happening. And
but here's the thing, Governor.
Very good level of compliance.
Governor, your residents are questioning how prepared your county is in the midst of a water shortage. Your county residents are worried that the county that you lead is currently facing water shortages during COVID-19. How do you respond to that?
Remember, for us to be able to implement the COVID-19 guidelines, we needed a budget for the same. That budget was passed last week, and I can now confirm that the water shortages that were a problem before have now been fully addressed. The provision of water in all our market points for washing hands and for citizen provisions have now been addressed. Remember, again, I said earlier, we are in a good time in terms of season because it is rainy season. So the severe drought effect normally part of Kajiado experience is not happening now. And so since the county has simply passed the budget and now the executive received the money to provide for water and all that is required has now happened. That is why we are able to acquire our ICU and ventilators since the budget came into force. So now that problem has been addressed.
Right. Governor, is there any free distribution of masks and sanitizers in Kajiado?
We are only able to provide masks to health personnel as at now. Ours is actually to sensitize the public to try and acquire them. And we are happy to see the national government trying to work our way out using NYS to provide more masks. We are also waiting for support from our development partners, which will also go a long way in supplementing our government's efforts.
Right. And Governor, perhaps we need to wind up our conversation. I would then love for us to take a look at the economic opportunities for Kajiado. We're seeing counties here in Kenya creating an economic boost within their own local counties, such as creating masks. What investment ideas or opportunities that Kajiado rather tap into during this COVID-19 that we've seen other counties doing, making masks and so forth?
First of all, we must accept that the greatest damage this COVID-19 has done so far is the damage to the economy. Many of our people are dependent on their daily work to get their daily bread, and that poses a great danger. And that is why there is top urgency in providing relief food, because many people who would work on a daily wage now are badly affected, and as a result, they cannot get their daily bread, and that needs to be quickly addressed. Of course, Kenya is a very enterprising community. A lot of people are now turning this COVID-19 into an enterprise through creating solutions to the problem that are associated with this. The question of masks, the question of hand washing. We are seeing people creating hand washing facilities where you really don't have to touch anything. Using your leg, you can press and get soap and get water. And so, yes, Kajiado, like the rest of the country, is trying to turn a bad situation into something that can create small opportunities. But the opportunities are so little or so limited compared to the massive job losses associated with the closing of businesses. It is out of this situation that we say that if you comply with the Ministry of Health guidelines, you will be allowed to do your business. And as a result, we never closed our markets. In fact, we are even now going ahead to say our saloon shops that are able to comply with these guidelines, making sure that the saloonists are properly covered with gloves, proper sanitation, they can also go ahead and do their business. So what we are basically doing is to try in a small way, following the health guideline, allow people to carry on with their daily life, observing the social distance, and also carrying out their businesses even in a limited way.
Right.
Because we appreciate that the government will never be able to feed everybody.
All right. Thank you so much, Governor. That's Joseph Ole Lenku, the Governor for Kajiado County, taking time to speak to us here on Daybreak.